my name is Glasha and I currently reside in London in the UK. I am a medical doctor by background, but I currently work in healthcare policy. The impact of COVID has been quite far-reaching. I think it's impacted just about every sector in society. The impact on society has been quite stark. So we went into lockdown at the end of March, and that looked for us like people working from home where they could. But we could only officially go out for one form of exercise a day and go out just for essential goods. And so it was really essential workers that were, allowed out. And I think that really had an impact in how we interacted with each other, how, it was really strange to see you walking down the street in my little village and people crossing on the other side of the road, and, at first it was difficult not to just take it a little bit personal, like, you trying to avoid me? But actually, yes, they were, because those were the instructions. So that was interesting. In terms of healthcare, so I think from a healthcare perspective, I think health and care services have largely held up in terms of capacity, both in terms of resource and in terms of bed capacity. So there's a big drive to set up very, very quickly these hospitals called Nightingale hospitals. So they went up in a matter of days. And while, it is undeniable the impact that this had on men and women on the front line and demand on acute services and, intensive care services and so forth, largely that additional capacity that was generated quite quickly, we didn't really have to use it to its fullest extent. So I think in terms of capacity for healthcare services, that has largely held up. And I think generally people are quite happy about that, because that was one of the main concerns. Are we going to have enough beds? Are we going to have enough ventilators? Are we going to have enough people to be able to deal with that? So that largely has not materialized. So that's quite helpful. There was a human cost to that, though. So obviously we had upfront line health and care workers contract COVID and dying, and there was a disproportionate impact on the health and care workforce that came from the Black and minority ethnic groups. So that was a picture that was beginning to develop. We're still fleshing out what that looks like and why and so forth. But I think, like everywhere else, there's been a heavy hit to the economy. So in the UK, the government committed to basically funding up to 80% of, or I think 80% of people's salary. So that pertains to people who have been laid off or not able to work because of COVID. I think it's capped at about £2,500 a month. I also saw a latest figure around GDP. So I think at April, GDP dropped by about a fifth, which is quite significant. So I think the impact on the economy is still being fleshed out. And I think the narrative on the impact of COVID will begin to become more and more about the economy. And it'll be interesting to see what impact that emerging narrative has on the country's response, basically, because it's been largely to date about people and mortality and those kind of things. I think it is slowly becoming about the economy and about money and those kind of things. So it'll be interesting to see what impact that has. One unintended consequence of COVID, I don't think this is anything that anybody could have predicted, is the disproportionate impact that COVID has had on Black and minority ethnic individuals. And so that has thrown up a lot of conversation around health inequalities, institutionalized racism, the experience of Black and minority ethnic individuals in accessing public services. And if you marry that with the context of George Floyd, it's like a bunch of things coming together that's really making a demand on government and private sector organizations, individuals to have conversations about race. I don't think anybody expected that when we were talking about a pandemic. I don't think that was a conversation that anybody anticipated. But now, at least for us right here, because of a few reports that have come out from Public Health England looking at the impact of COVID on different groups of individuals, that is a big part of the national response to COVID at the moment. Public health messages, I think, really help with this. So a good comm strategy really helps. Things that people can easily remember, something that is simple and effective for people to quickly draw on, regardless of their, awareness or education level and those kind of things. I think definitely here, there is still quite a lot of respect and trust and faith put into healthcare professionals. So I think having them speak more about things that would largely be not visible to the public. So talk about the impact of COVID on individuals, because we hear these terms, we hear these numbers about people dying and those kind of things. But the general public would not know what it is like to see somebody die from COVID, or to deal with the grief around that, or it's still very external. But when you hear from healthcare practitioners dealing with the human cost and the realities of this, I think it helps to focus minds. Hearing from politicians, I think generally people are like, okay, whatever. But the doctor down the road, or the nurse who you trust to look after you, and those kind of things, I think helps to keep those messages fresh. And definitely, although it wasn't an active part of the government campaign here, I don't think, Twitter and so forth, and people went to Twitter and was talking, I think that provided a lot of penetration into homes and into hearts about how serious this is. So I think we're looking at different ways of saying the same message. I think helps. If you have a non-COVID related healthcare concern, if it's worrying you, if it's something that could be potentially detrimental, or you're not really sure, please see your healthcare practitioner. I think what has happened, and we still don't know the full impact of this, but I think what has happened is people have, there's been a decrease in people accessing medical advice. I guess things like lumps and bumps and moles and so forth, that they're not really like urgent. You're kind of a little bit worried about it. And they're the kind of things that you probably don't readily go to the doctor about anyway, until it starts to really, kind of just stay on your mind. If you put that in the context of, you're thinking that healthcare places are just riddled with COVID, you're like, well, I'm not going. It's not hurting me right now, or whatever, I'm not going. And so there's a concern that there's going to be a delay in picking up, cancers and so forth, as a result of people just being reluctant to access service. So one of my pieces of advice would be, if you have a non-COVID health complaint or problem, please access the services that are still available for the general population. And I think one last thing I would say is there isn't any guarantee that we will not contract COVID. And then the most you can do is try and stay well, eat healthily, exercise, that kind of thing, optimize our bodies, optimize our physical state so that in the event that we do contract COVID, we give ourselves the best possible chance of combating it, and our body and our immune systems to deal with it. So there is a wide range of things that we can do and be engaged in to put ourselves in the best possible place. So I think we have had a similar situation where a lot of our outpatient and elective activity has been halted, and beds and personnel has been rediverted to fight COVID. But there is an consideration around the funding. Number one, here in the hospitals are funded by by NHS England, who are funded by the Department of Health, ultimately the government. But within the contractual arrangements with hospitals and where they get their funding streams from, it is the elective activity that generates income. And so there has been quite a significant reduction in your hip surgeries and your knee surgeries and those kind of things. And so I think, although that hasn't yet been a big part of the narrative, I think that will come more to light. And I think that maybe at the next financial year end, which will probably be, I don't know, April next year, then there may be a story to tell. But I don't think we know exactly yet what the financial impact has been on hospitals from COVID. I mean, the government has they've plowed additional money into services kind of at the beginning. And I remember our Secretary of State wiping away some debt that the hospitals had owed and things like that. So I think the government has tried to offset the financial cost, but I don't know if that is possible in its entirety. So again, I don't think it'll be a surprise to know that my concern is about a second wave. We have countries opening up in the context of COVID having not gone away. COVID is still here and it's still with us. And in some cases, we are opening up when there is a higher prevalence of COVID than there was when we decided to close. So there is a likely chance that there will be a second wave. But I think more specific to this country and probably maybe other temperate countries, we are after the summer we start looking and preparing for the flu season. So if we do have a second wave when there is also your usual seasonal flu issues to deal with, that usually, even without COVID, stress healthcare services and systems, then I think that would be a perfect storm, really. And that is one of my greatest concerns. And I don't think anybody really knows what is going to happen. So there's a little bit, for me, there's a little bit of a fear of the unknown associated with that. But in terms of what the future looks like, I do not know. Like literally, I think what I've realized is nobody knows, I don't think any government or organization or any person has the complete answer. I think people take best guess, but I don't think they really know. I think unless there is a vaccine quickly that's quite effective, we're probably going to have COVID around for a little while, even if it's eradicated from your country. Even if it's eradicated from the UK, the UK is not going to completely close its borders to the rest of the world. So there's always going to be the risk of COVID entering through various different borders and means. So I think we have to look at, in the short to medium term, maybe longish term, about how do we live with COVID. I think what we are looking at right now in the UK is how do we recover health and care services, recover public services alongside dealing with COVID. So I don't think there is a great conviction that there is a post-COVID quite yet. Is how can we all get along, COVID and all? How could COVID coexist with all the other things that we need to do? I think that is the focus of efforts or planning for the next kind of foreseeable future. The urgency is in therapeutics. What can we use to treat and treat successfully COVID? If I'm looking more longer term, though, I would look at plowing as much as possible into developing a vaccine. And the reason why I chose therapeutics as being more urgent than vaccines is because there's a time element to vaccines. There's something that just can't be rushed, no matter how much is needed right away. And I think when anything is rushed, there is always a risk that quality is sacrificed. So in terms of time frames, I think right now it is about what can we use to lessen the impact or cure COVID in the event that it is contracted. But longer term, definitely, we'll be wanting to increase immunity and look to developing a high quality vaccine.